Bunions affect the big toe joint of the foot, which is comprised of the first metatarsal and the proximal phalanx of the big toe. Bunions are progressive deformities, so they gradually get worse over time. Some patients, they will develop very quickly, and others they will take a long time to develop. Generally, you'll get sweeping out of the first metatarsal, and then you'll get that angulation of the big toe moving in towards the smaller toes. So the more progressive the deformity, the more you'll see that bump on the outside, and the more you'll see the big toe pushing against the little toes. Remember that bunion pain doesn't always correlate exactly with the severity of the deformity. Sometimes a moderate bunion may not cause that much pain, and sometimes a mild deformity could cause a lot of pain. So typical symptoms that the patient will feel are usually, well, it can be a combination of pain. Sometimes it can be a sharp pain. So as their foot, the heel lifts off the ground and that big toe gets pushed upwards, sometimes they'll get pinching in that joint. Other times they'll just get a general aching with the longer that they walk. One of the reasons for these symptoms is that, as you can imagine, the first metatarsal swings out, the big toe swings in, so the congruency of that joint is not ideal. And of course, you're going to get some grinding and pinching along that area. People with bunions generally have a genetic predisposition for them, so they'll find that their parents or their grandparents may have developed these in the past, and therefore they're more likely to develop them. It's not always a strict rule, but generally you'll find people with hypermobility in their feet or have extremely flat feet are more likely to develop them. One big exacerbating factor in aggravating bunion development is footwear. So if you wear a heeled shoe, it transfers weight to the front of the foot, so you'll get increased forefoot pressure. If you're also wearing a shoe that has very tight, squashed toe boxes, it's going to push the toe over. And if you combine those two things, such as a high heel, you're going to have all the pressure pushing into the front of the foot and then the shoe pushing the toe over. So this is why we find that there's more women than men who develop bunions. There are different treatment options for bunions. You can try all the strengthening and stretching exercises. The stretching exercises will help reduce the collapsing of the medial arch, which should reduce the forces in the area. The strengthening exercises might help keep the arch lifted up, and maybe that will reduce the forces in the big toe joint as well. The other thing you can do is wear good supportive footwear that have plenty of width in the toe box in the front and plenty of support in the rest of the foot. Generally, a good running shoe is good for this, although I appreciate it's not always practical for every patient at all times. If you're not a podiatrist, it's worth working on calf stretches and foot strengthening exercises, and also encouraging your patients to wear good footwear as well to accommodate the bunion. If they're still experiencing some discomfort, it's probably worth referring them to a podiatrist that can look for other options. One of the first treatments that a podiatrist could help with a patient is by making them a custom orthotic device, which is a customized insole to fit inside their footwear. This should stabilize the foot, stop it from rocking left to right. It should reduce the forces and the aggravating forces that are pushing through that bunion, and can, in some case, slow down the progression of the deformity. With bunions, there's nothing that will reverse the bunion without surgery. So in some cases, if patients have tried all these different treatment options and there's still no luck, then they will likely need to have some surgery. Surgical options work by correcting the alignment of the first metatarsal and that proximal phalanx, so you have good alignment of that foot. And this increases the congruency of the joint. Surgical outcomes are very successful for treating bunions. They historically had a bad reputation for being very painful, but the techniques nowadays are extremely good and have very little recurrence rates. If you're not a podiatrist and your patient is really not interested in having surgery, then really try to get them working on calf stretches and all the other exercises that we've shown you, including the massages and strengthening exercises as well. You can also refer them to a podiatrist that can help make them some custom orthotics and encourage them to wear good footwear to accommodate the bunion and to reduce and slow down the progression if possible. Generally, what happens with a bunion, you'll see an angulation between here and here. So the toe joint will do this. As it progresses, it'll move outwards like this, and you'll see the toe start to push against these toes and push them across there. So if you have pain in the joint, sometimes it might be because of arthritic changes, but other times it might be because there's a bunion. The way you can tell this is by having a look to see whether the alignment between there and there is increasing in angle like this. The more it progresses, the more of a progressive deformity you have. Now, pain in the big toe joint is not always a bunion. It could just be arthritic changes in the toe joint, which is extremely common. But if you see the angle between this one and this one here, if you see that angulation with a bit of a bump coming out here, then it could be that it's a bunion and it's not just arthritic changes in the joint. The other thing with bunions to note is because the big toe joint doesn't function as it should, there's often a lot of transfer pressure. So you'll get pressure when walking from the big toe joint over to the second one. So often people with bunions can then start to present with pain under the second toe joint. And some people initially are maybe a bit thrown off by this. You might say, oh, they have a bunion, but the pain seems to be next to the bunion. And usually it's because if you have transfer pressure over to this one is compensating for the lack of motion you have in this one. So you need to take a good examination of the foot. You need to make sure that if the bunion is maybe not so sore, but the second joint really is sore, then maybe it's a good time to try and treat the bunion, because you don't want it to get worse, and you certainly don't want the remaining toes in the foot to become affected because of the bunion.